morning.
Welcome aboard. I'm Dr. Tridin from Nepal, and I'm a licensed acupuncturist on board, and I'm a pain specialist. I've done my doctorate in naturopathy and yoga, and I've done my master's in clinical psychology, and I've done my master's in acupuncture. And since then, it's been 16 years that I've been working in different hospitals in land, and now I'm in the sea. Having said that, in land, I was working in different hospitals under the orthopedic surgeons and neurophysicians. Why I'm mentioning this is just because I want everyone here to know that acupuncture now is no more traditional and no more miraculous, because there are lots of studies and researches been done. You must be aware that there is also an acupuncture anesthesia so famous. They have also done tooth extraction with the help of acupuncture anesthesia. And there are so many acupuncture treatment done in the time during labor pain. Okay, so today I would like to go into the topic. Today we are talking about arthritis solution. So when we talk about arthritis, it's all about pain, right? So when we talk about pain and arthritis, it's more about the bigger joints, maybe the back or cervical or knees, right? And also the phalanges, yes. Okay, so what are the cause of this pain? So when we initially start, pain always starts just because of the muscles, because of the occupation that we are doing, the activities that we are doing. What happens is with the repetition of the same action, like falling forward or sitting in a computer for a long time or a long standing, like any kinds of occupational hazards, like they tend to strain your muscles. So whenever there are so strenuous muscles, that's the first time when you elicit pain. Okay? So when there is a pain, what we do, we usually take medication just to maintain that. And the other type of cause of pain is a disc. The vertebrae in between, I'll just show you this one. The vertebrae in this, once the muscles are spasmed, there's tightness in these muscles. Now just imagine this is your vertebrae, and imagine these vertebrae are held with muscles, tendons, and ligaments. Now imagine you're working so hard, the muscles are so tight, and that has turned into spasm. No more contraction, but spasm. These bones comes together, and the more you fall forward, what happens is these bones starts to have friction in between, and then the pressure goes on so that you see, you can have a sec, yes, please. So there's a disc in between the vertebrae, get compressed, and you can see that it's bulging outward. Now imagine the nerve that is coming from up, the spinal cord, gives the branches that goes down to your legs, to your arms, right? So these disc gives a pinch to those nerves, and that gives you pain throughout your legs. So you feel different kinds of sensations like needles and pins, numbness and tingling sensations. Okay? So what arthritis is really about? It's all about pain in the joints, which is chronic degenerative pain, and it has inflammation, swelling, and stiffness in your joint. That gives you limitation with all the movements. Okay? And if you talk about the causes, there are like multiple causes. One is genetic, the other one is infective, and it may be road traffic accidents, any kind of trauma, or any kinds of metabolic disorders. Okay? So when we talk about genetic, we have rheumatism, if you've heard. Have you heard of rheumatism?
Yes.
Lupus, okay, ankylosing spondylosis, which has also inherited and also it is an infected. Have you seen ankylosing spondylosis? Anyone here? Have you seen people just walking around and they have so tight spine that if somebody calls, you have to roll it all the way back. They can't just turn. Okay, so it's an autoimmune disease, lupus and rheumatic arthritis. So what you have is our own immune system starts to eat up your soft cartilage of your joints. Okay, so what do we do if we have all these types, like osteoarthritis, rheumatic arthritis that we were talking, the ankylosing spondylosis? A gout is something, it's related to your metabolism. Okay, when the proteins that you take in is not getting digested inside, that protein get deposited in different parts of your joints, and that joints get stiff, pain, swollen, and that also limits you from any movements. Okay, and fibromyalgia, it's also a kind of arthritis where you have so much pain all over your muscles, all over your joints. There's no one single muscle or joints that you say there's no pain. And there is no single cause for these problems. Okay, so even when we talk about a knee joint, now imagine you have a sedentary life, or you have an exercise that you've been repeating every now and then without toning your muscles. So what happens is, this is a normal knee joint. Okay, so these two bones are normally held by the muscles and ligaments again. There's no other parts that can hold these bones together. Now imagine when these muscles are weak enough, you have a very less space in between, and with the more movement, what happens, there's a friction happening in between the joints, and you can see it starts to join and have friction in between. That's leading to inflammation and degeneration, pain and stiffness, and the limitation of movement. Okay, so when we talk about rheumatic arthritis here, so we have, say, our own immune system is trying to eat up your soft cartilage here, and there's giving a whole sum of inflammation going on. That's right. So this will also prevent you from movements and pain, definitely. So what do you do for this pain normally? So when we everybody know, we take medications like painkillers, antidepressant, steroids, and when nothing works, they would say, okay, total knee replacement or spinal surgery. That's the most medical facilities can help you with. So when we talk about medications, non-steroidal anti-inflammatory drugs like aspirins and any kinds of painkillers, if you look into a study, it says that 51% of these medications leads you to liver failure, gallbladder bleeding, and it's a 15th cause of death as an epidemic. And there are other medications like COX-2 inhibitors. They also lead to gallbladder bleeding, and any kinds of steroids or non-steroidal anti-inflammatory drugs gives you heart attack and stroke at the end. So these are all the side effects of the medication that we're already aware of. And an intake of steroids on and off will also develop thinning of your cartilage and weakening of your bones, decreasing your density, and you're more prone towards osteoarthritis. Okay. So when we talk about the pharmaceutical management that we are taking, because we don't have any other options than this. Though we know these all medications are giving side effects to us, we do not have any other options. This is why we're here. So I would like to introduce traditional Chinese medication. This is actually a century back, 3,000-year back practice. And it has been tested, it has been experimented every now and then, but still it's a traditional practice. But as I did mention you earlier, it is no more traditional. Okay, I'll tell you how it works. Now, by putting. Do you know? Have you ever tried acupuncture before?